Hello there, I'm Fidelia Margaret Francis and I'm a second year medical student. Today I'll be performing an abdominal examination on you. So before I proceed, I'd like to confirm your details. Are you Mr. Chuck?
Yes,
And how old are you this year?
33.
Alright, so for this process, I'll be required to have you to expose your abdominal area and I'll be required to touch your abdomen as well. Will that be okay?
Okay.
Alright, so without further ado, I'll have you to remove your shirt. Is that okay?
Okay.
Right, so first of all, I'll be inspecting the abdominal region to look for any visible scars for previous surgery or any injury as well. And then I'll be looking for any discoloration like pallor, jaundice, any redness, any blue-black marks for bruises. And I'll be looking for other things like any extra tubes or devices attached to the abdominal region. And I'll be looking for things like caput medusae, striae, stretch marks, scratch marks, and any abnormalities as well. So once I have had an overlook of the abdominal region, I'll proceed with the palpation. So before I proceed, do you feel any pain?
No.
Alright, so I'll proceed with the palpation. First, I'll start with the light palpation. This will help me to identify if the patient is feeling any pain, to feel any masses, and to feel for any rebound tenderness as well. Next, I'll proceed with the deep palpation of the 9 quadrants. This will help me to identify the specific location of the mass. It will also help to identify the characteristic of the mass, such as the mobility of it and the size of it and how the surface of it is. So after palpating the 9 regions of the stomach, of the abdomen, I'll proceed with palpating the border of the liver. So I'll start with the right iliac fossa. Any enlargement of the liver that exceeds the border, which is about 1 to 2 centimeters below the costal margin, will indicate a hepatomegaly. And now I'm palpating for the spleen border, because when the spleen enlarges, it enlarges this way, which is why I palpate from the right iliac fossa as well. Next, I'll be palpating for the border of the urinary bladder. Alright. Next, I'll ballot the kidney by placing one arm on the top and using my other arm to ballot from the bottom. Next, I'll be testing for cholecystitis by performing the Murphy sign procedure. I'll have you to inhale once I give the sign, okay?
Okay.
Please inhale. If the patient winces in pain or shows any sign of pain during the palpation, it indicates a positive Murphy sign. Next, I'll proceed with the percussion procedure, and this will have me to tap your tummy. Will that be okay?
Okay.
Alright, Mr. Chuck. So first of all, I'll percuss the border of the liver. There should be a sound from resonance to dullness. The same goes for the spleen as well. And I'll repeat the process for the urinary bladder. Next, I'll be performing the test, percussion test for shifting dullness. So I'll percuss from the center of the abdomen. Until I hear a dull sound at the flank. So I'll have you to roll over. Is that alright, Mr. Chuck?
Sure.
I'll wait for 30 seconds. Assuming that 30 seconds are over, I'll continue to percuss back from the flank to the umbilicus. If the sound of resonance to dull becomes the opposite once the patient has rolled over, it means that shifting dullness is present and it can indicate ascites. Next, I'll look for any aortic aneurysm by palpating in the center here. If there's an upward movement, it indicates a pulsatile aneurysm, and if it's outward, it indicates an expansile. Next, I'll be auscultating to hear for specific and abnormal bowel sounds, aortic sounds, and renal artery sounds. Next, I'll be looking for the aortic sounds and renal artery bruits as well, to the lateral of the umbilicus. So that's all for today's abdominal examination, Mr. Chuck. You may wear your shirt now. Thank you so much for cooperating with me today in this abdominal examination, Mr. Chuck.
You're welcome.
Thank you.